As a middle-aged woman who has ascended and descended a set of stairs multiple times this afternoon, I'm eager to learn from our MCubed's presentation, titled Falls and Vision Impairment Among Middle-Aged Women. This cube includes faculty and staff members from the School of Public Health and the medical school, a fellow from medicine, and an undergraduate student from public health. Representing the team today are Professors Carrie Ann Carvinen Gutierrez and Sayoko Morai, and postdoctoral fellow Navasuja Kumar.
Thank you very much. I'd like to take a quick poll of the audience here. How many of you have actually fallen? So that's the majority of you. Well, falls are certainly complex, but I had a patient come in who was part of our study, and she informed me that she had fallen. She had evidence of this. She had bruises all over her face, and she said, "I fell because I didn't have glasses, I couldn't see my dog, and I tripped and fell." So we wanted to go ahead and test the hypothesis of vision impairment in relation to poor physical functioning.
Among older adults, those aged 65 years and older, vision impairment is common and is a known risk factor for falls. Nearly 1 in 3 older adults falls annually, and of those, nearly half are injured. And in 2015, the United States Medicare system paid out over $31 billion in direct medical costs related to fall-related injuries. So everything thus far that I've told you on this slide, I've been very careful to note that it's among older adults. Why is that? Is it that once you reach that magic age of 65, you suddenly start to fall and you're immune before that? No, certainly not. In fact, many of you in the room, I can see a little bit under these lights, are of the demographic we call midlife, middle age, 40 to 65. And when Dr. Morai asked, most of you raised your hand that you had fallen. And for those of you that didn't, perhaps you have a friend, a family, a colleague member that's had a fall. Although I'm not quite midlife yet, I have several colleagues who've shared their stories with me about their serious falls that they've had during this life stage. I have a very dear friend and colleague who fell down a flight of stairs, fractured her femur, took more than a year to recover, and continues to have severe arthritic symptoms in that knee. So why is it that we as a public health and medical community aren't paying more attention to falls that happen during this life stage? Is it that the falls during this life stage perhaps are not as serious as they are older adults? I contend no. The story I just told you about my colleague, she continues daily to have arthritic symptoms in that knee. And further, the data tell us that falls during this life stage can be just as serious among older adults. 14% of midlife women and 9% of midlife men have a serious, injurious fall each year. Perhaps it's that we're more resilient to a fall during midlife, that we can bounce back in a way that we can't during late adulthood. Well, again, I contend that that's probably not the case. We're working on some data now using data from a representative sample of the United States households, and we see that having a fall, even during midlife, is associated with 3 times increased risk of mortality in the next 10 years, after adjusting for other risk factors for mortality.
One possible step towards reducing midlife falls is reducing the burden of visual impairment. But how common is visual impairment among the midlife adults? To answer this question, we looked at the data from the SWAN study of women's health across the nation. It's a population-based cohort study, and Michigan is one of the 7 clinical sites. The Michigan SWAN study measured visual acuity using a vision screener similar to that used at the DMV. And the data showed that 19% of midlife women presented with distance visual impairment, can't see very clearly while driving, and 40% presented with near visual impairment, can't see the tiny prints very well. This level of burden caught our attention and prompted us to consider how the 2 conditions, visual impairment and falls, both of which are underappreciated in the midlife years, may be related. and the MCubed team was formed as a result. The Michigan SWAN study had this wealth of data collected over the past 2 decades among a cohort of about 550 midlife women. And the data included visual acuity information, physical functioning, menstrual data, menopausal status, hormones, and so forth. And the Michigan SWAN study was looking to apply this data more broadly to all aspects of physical functioning, and it started collaborating with the Department of Ophthalmology. Around that time, I was finishing up my master's in public health here at the University of Michigan. As an ophthalmologist trained in India, I was looking to work in an area that connected my interest in eye and vision health with epidemiology. And the MCubed team provided the perfect opportunity for me to do so. And the MCubed project was also a great opportunity to form interdisciplinary collaboration, to be able to look into the contribution of an important sensory input like vision on physical functioning and falls, and also understand the needs for preventative and treatment strategies that need to be targeted at the midlife population to ensure healthy aging of adults.
So what we did next is worked with our partners in public health, and we went light speed ahead from vision screening and a population-based, and invited these women to participate in an ancillary study as part of their core studies of SWAN. And we tested for the following conditions, looking at need for glasses, as you see here, dry eye, cataract, glaucoma, macular degeneration, diabetic eye disease, hypertension eye disease, and other eye conditions.
One of the most surprising findings to us that came out of actually getting clinical eye data for these women rather than just the screening is that 2/3 of women had contrast sensitivity impairment. Contrast sensitivity is your ability to distinguish between shades of gray. An impairment in contrast sensitivity inhibits your ability to engage in activities like nighttime driving. Another surprising result to us was that 1 in 5 women, or 20%, fell in just the last 6 months. And when we looked at women who had vision impairment or contrast sensitivity impairment, their risk of falls was increased by 40%.
So thus far, what have we learned? Well, we certainly know that falls are complex, but we did from this cohort learn that vision does contribute to that. And what a nice simple thing to be able to provide a prescription for eyeglasses to help some women at least enhance their vision so they can decrease their risk for falls. But as I said, falls are more complex. What do we have to do? We have to find out the other variables through collaboration so that we can try to reduce the risk of falls.
So just over a year ago, as this Cube was just launching, the United States Preventative Services Task Force, which is our nation's leading experts in primary care and prevention, released their recommendations on screening for visual acuity. Their recommendations stated that the evidence was insufficient to recommend visual acuity screening in older adults. The evidence was insufficient. This was a call for us. This was a call and a motivation for us to continue this work and move towards the generation of evidence needed to inform policy and make informed decisions to improve the health of midlife and older adults. So how are we doing that? Well, thanks to the MCubed, we've been able to engage our women, which are part of a community-based sample, in clinical testing for eye diseases. 250 women have completed in-person vision exams with the metrics that Dr. Maroy mentioned, and we're continuing to follow them up for falls, as well as related to the circumstances of those falls. We have 2 decades of data on these women that we can then link those metrics with. We're presenting at meetings, we're writing papers, analyzing data, and applying for additional funding to continue this work. But what we continue to come back to is our motivation, both from that recommendation from the United States Preventative Services Task Force, but also stories that we hear from our friends, our family, our participants, and our patients, as the woman that Dr. Maroy started our talk with, who we see these impacts of the coincidence of vision impairment and falls, and knowing that falls are happening earlier in the life course with just the same level of seriousness as they are later. And we're motivated to think big, collaborate, and continue our work to improve the health of the public. Thank you for your attention.